Bad breath after getting composite veneers. Have you ever noticed that your mouth sometimes doesn't smell as fresh or pleasant as you would like after having composite veneers applied? A lot of people think the problem is with the composite itself, but in reality, that's just the surface of the issue. In this video, we're going to look at the real reasons behind bad breath after getting composite veneers. From improper installation of the composite to daily habits you might not even think about. No, the composite itself doesn't produce any odor, but if the edges of the composite aren't properly finished during installation, or if tiny gaps are left between the composite and the tooth, bacteria can accumulate there. They accumulate and create an unpleasant odor. This is what we call improper installation. A loose dental restoration, such as a composite or veneer, can be one of the causes of bad breath in your mouth. When the composite gradually separates from the surface of the tooth, moisture and bacteria collect underneath it, and that means a persistent odor. Also, if the gums are inflamed or infected, they themselves are the main source of bad breath, even if the composite is completely healthy. Some foods and medications themselves cause bad breath, like garlic, onion, coffee, alcohol, or certain medications that cause dry mouth. Cigarettes and hookah are also the #1 enemies of fresh breath, especially after getting composites, because the underside of the composite absorbs odors even more. Now we get to the most important factor: oral hygiene. If you don't use dental floss and a special toothbrush, food particles get stuck between the edge of the composite and the tooth and cause bad breath, especially at night before going to bed. When your mouth gets dry, bacterial growth multiplies several times over. Sometimes the problem isn't even with the teeth at all. Some illnesses, like stomach issues or sinus problems that turn into sinusitis or diabetes, can cause bad breath. In these cases, even the best composite can't hide this odor because its source is inside the body, not in the mouth. So the short and straightforward answer is that composite material itself does not directly cause bad breath. However, if the composite dental work is done improperly or incorrectly, poor oral hygiene, gum disease, or unhealthy eating habits, such as consuming sugary foods, may potentially cause or worsen this odor. If you have this problem after getting composite, the first thing you need to do is find the source, not just try to hide it. I'm Dr. Afshin Mirzaei, and on this channel I talk about simple and scientific ways to take care of your smile. So, if you're looking for a healthy and lasting smile, subscribe to the channel and make sure to like this video. Take care of your pearls.